The black power cord powers the bed controls and the IntelliDrive powered transport mechanism. The bed has a built-in battery for frame articulation when unplugged from power. The bed should be plugged in at all times except during transport to maintain the IntelliDrive and bed battery charges. The battery charge indicator on the intermediate rail comes on when the battery is charged. If the bed is unplugged, press the function to activate the battery power status. The low indicator flashes when the battery is low, and an intermittent tone sounds every 2 minutes when the battery reaches low condition and AC is unplugged. The indicator light will turn off if the battery is too low to operate the bed. A permanent IV pole is located at the head of the bed and can be stored when not in use. To raise the pole from a stowed position, lift the pole up and drop it down into the holder, locking it into position. To add height to the pole, secure the base of the pole while raising the middle and upper section of the pole to the desired height. Do not mount infusion pumps to the lowest section of the pole to avoid interference with the head of the bed during articulation. Clamp pumps onto the middle, thicker section of the pole for a secure fit. To shorten the IV pole, pull the black knobs out and the pole will collapse into itself. To stow the pole, lift the pole up and fold it down. Dual oxygen tank holders are located at the head end of the bed. Place the oxygen tank in the holder and the holder will automatically cradle the tank. To remove the surface from the frame, raise the head of the bed to 30 degrees. The surface is connected at the head end of the bed by 2 white connections. Lift the center of the surface up, then push the side of the surface inward. This will remove one connection. Then slide the second connection loose. Repeat at foot end of bed. To clean under the surface, remove the connections at both ends of the frame. You can now lift up the ends of the surface simultaneously or independently to clean the frame deck. There are 3 green steer and 3 orange brake pedals on the bed. 1 on each side of the bed and 1 located at the head of the bed. Use the brake to keep the bed from moving. Step down on the orange brake pedal until it is in the full downward position. Pull on the bed to make sure the brake function is fully engaged. Use steer to move the bed in a straight line and maneuver through hallways. Step down on the green steer pedal until it stops in a full downward position. Use neutral to move the bed in any direction. Move the brake or steer pedal so that it is level. Neutral helps with sideway movement in a room or small enclosed area, and when aligning the bed with another surface, such as X-ray table or stretcher. This allows free movement of all casters. A brake nut set alarm will sound, and a message will pop up on the GCI if the brakes are released while the bed is plugged into AC power, alerting that the bed is in an unsafe position. Unplug the bed for transport, or set the brake when parking the bed. For transport, set the brake steer pedal to steer and unplug the bed from AC power. These first 2 steps automatically lower the drive wheel, but will not power the IntelliDrive system. Grip one or both handles and depress at least one of the black enable switches on the underside of the transport handles. This engages the drive wheel on the bed to prepare for moving the bed. To move the bed, push or pull on the handles while depressing the enable switch. Decreasing pressure on the handles will slow the bed down to go onto elevators and through doorways. To deactivate the IntelliDrive powered transport system, set the brake or steer pedal to neutral, or engage the brake and plug the bed into AC power. There are two push handles located at the head of the bed that can be stowed when not in use. For transport, lift up on the handles and drop them down into the locked position. To lower and store the handles, lift up to unlock and fold down toward the center of the bed into a stowed position. Attached to the transport push handle is a blue hook to wrap the power cord during transport. To lower the side rails, locate the blue lever in the middle of each side rail. Place your hand on the blue lever and lift it up to release the rail latching mechanism. The side rail has a dampening mechanism and will slowly lower. To raise the side rails, pull the side rail up until it latches into the locked position. When you raise the side rails, you will hear a click when it is locked into position. Once the click is heard, gently pull on the side rail to make sure it is latched properly. Controls on the outside of the head and intermediate side rails allow for a change in frame positions. To raise and lower the bed height, use the bed up and down arrows on a side rail on the caregiver control panels. If the bed is not in the lowest position, a yellow icon on the side rail will be illuminated and will disappear when the bed is in the lowest position. To raise and lower the head of the bed, use the head up and down arrows. Notice as the head is elevated, the GCI home screen on the intermediate rail displays an accurate head of bed angle. The head of bed angle indicator on the outer upper rail provides an estimated head angle. Use the up or down arrows to raise or lower the knees. The caregiver pendant is designed for caregiver use only. There is an enable control on the pendant to deter unauthorized use. The enable control is associated with the functions connected to bed up and down, chair position, bed flat, max inflation, and trend, reverse trend. To enable, press and hold the enable control until the indicator light comes on. This will remain enabled for 60 seconds. During the 60-second period, you can activate any function without pressing enable again. If performed incorrectly, you will hear a triple beep and instructions will pop up on the GCI. To raise and lower the height of the bed using the hands-free foot controls, use the top of your foot to press the unlock button on the underside of the pedal. After 3 seconds, you will hear a beep to let you know the controls are active. Step down on the left side of the pedal to raise the height of the bed, or step down on the right side of the pedal to lower the height of the bed. The feet and lower legs can be lowered from flat to -70 degrees by using the down control. The legs can be raised to flat by using the up control. Level and flatten the entire bed with the bed flat control, which will reverse all positions, such as the head, knee, feet, trend, reverse trend, and chair position. If starting in the chair position, it will move through the reclining position on the way to level. A single tone will sound when the bed reaches a level position. For tilt in either direction, Trendelenburg, reverse Trendelenburg, use the side rail controls. To engage CPR, there is a red CPR hands-free foot lever on both sides of the lower bed frame. To activate CPR, step and hold the red lever down until the head of bed is flattened and you hear a single tone. The legs will then level and the mattress will automatically go into max inflation for 60 minutes. The boost feature provides you with a one-step way to reposition a patient versus multiple steps using the side rail and GCI controls. The control is on the intermediate rail within the caregiver pod on both sides of the bed. To activate, press and hold the boost control. This will flatten the head and foot of the bed, may adjust the bed height, and it will activate max inflate, all in one step. If Trendelenburg is desired, continue to press boost control until the desired position is achieved, or up to 8 degrees of tilt. After repositioning the patient, turn off max inflate via the GCI or head side rail. Level the bed if in Trendelenburg using the level icon in the caregiver pod, and position the head of the bed to desired elevation. Lengthen the bed using the foot icon with the arrows pointing toward the foot end of the bed. To shorten the bed, use the icon with the arrow pointing toward the head end of the bed. The bed can be adjusted 10 inches. To activate full chair position, press and hold the chair control on the intermediate side rail until desired position is achieved. A triple beep sounds with a GCI pop-up. Watch for drainage devices. During transition to chair position, the frame will slightly recline backwards, and the seat and lumbar cushions will slightly deflate. When the footboard is on, bed articulation will stop, and a tone will sound when the bed has reached the full chair position. Once you release the chair control, the cushions will reinflate to normal pressure. If you intend to leave the patient in the chair position with foot support, leave the footboard on the bed for patient comfort and safety. Some patients may require a pillow or blanket for foot support. Chair egress is intended for patient exit, not for long-term sitting. When the bed beeps 3 times, follow the GCI screen prompts for chair egress procedure. Set the brake. Remove the footboard if installed. Press and hold the chair button until the bed reaches full chair and lowers completely. As the chair button is being pushed, the GCI screen provides information and shows a green progress bar on the bed from flat through to chair exit position. Once the bed is in the full chair position, the GCI suggests releasing chair button until a beep is heard, indicating the seat is deflating, preparing the patient for chair exit mode. Press and hold the chair button again, and the bed will tilt forward to assist with positioning the patient for placement of their feet on the floor. Always move the patient forward enough to help support them with placing their feet on the floor before exiting the bed. If needed, press and hold the chair control to inflate the back section of the mattress to the desired amount to help bring the patient forward for egressing out of bed. To lock out or disable a bed function, press the lockout control and the bed function control you want to lock at the same time. When you do this correctly, you will hear a single confirmation beep, and the function padlock will become illuminated. To unlock, repeat these steps. Press and hold the padlock and select the bed movement function you want to unlock. If you attempt to use a function that is locked out, you will get a reminder on the GCI that the function is locked. If the lockout procedure is performed incorrectly, the bed will beep 3 times, and a screen on the GCI will pop up providing lock or unlock instructions. The various bed movement functions will be illuminated and flash. Emergency CPR cannot be locked out. If CPR is activated, any locked controls will be unlocked. Any leg or knee control will lock all leg and knee controls except the retractable Flexifoot mechanism. The Flexifoot mechanism will only lock this feature and still allow for changes in leg, knee positioning. Any lockout will lock out chair and the bed flat controls. High-low bed height lockout will lock out trend, reverse trend. The GCI is located on both intermediate side rails. You will find the bed status, bed alarms, scale, surface controls, and pulmonary therapies within the GCI. If the touch screen is black, lightly touch the screen to wake it up and slide your finger in the unlock area in a left to right motion to access controls. Indicators above the slide will turn green. Therapy tab is indicated by the lung icon. This tab allows you to initiate or stop pulmonary therapies such as rotation therapy. To access these, select the lung icon on the far right of the home screen. Rotation has 4 rotation tabs, 1 custom setting, and 3 pre-configured settings: full, moderate, and minimum. To use the pre-configured full, moderate, or minimum settings, select the mode and tap on Start. These are pre-configured and are not changeable. To use the custom settings, select Custom tab. Tap the setting you want to change, percentage of rotation, or pause time. Use either the arrow or scroll bar to make changes. Once you select Start, you will be asked if you want to use rotation training. Select Yes or No. Rotation training will start rotation at 50% of the maximum rotation setting and increase 10% every hour until the maximum setting has been achieved to help a patient become acclimated to the rotation. All 4 side rails must be raised, the head of bed no higher than 40 degrees, and the foot of bed no more than 30 degrees for rotation or P&V with rotation to start. Align the patient's shoulders with label in the head side rail for best lateral rotation before starting therapy. To stop a therapy or to change a setting while in rotation, select Stop Therapies from either the home screen or the Therapy Lung icon. You will be asked if you are sure you want to stop all therapies. Once stopped, wait approximately 1 minute if you want to make a change. Then go to Rotation screen, make changes, and hit Start Therapy. Only the out-of-bed exit mode can be used during rotation. To deactivate rotation therapy, select Stop Therapy. The Therapy tab is indicated by the lung icon. This tab allows you to initiate or stop pulmonary therapies such as percussion and vibration therapy. To access these, select the lung icon on the far right of the home screen. P&V has 4 settings, 3 pre-configured settings, high, medium, low, and 1 custom setting. This works the same as the rotation settings. To use the pre-configured high, medium, low settings, select the mode and tap on Start. The intensity, frequency of beats, and duration of treatment are preset and are not changeable. To use the custom setting, select Custom tab, and then make selections for intensity, frequency of beats, and duration of treatment. For all 4 settings, you can then select Position if you want to position the patient on their left or right side, or in rotation, or in a center position for the treatment. The P&V will be delivered across the patient's back. The position is for postural positioning. Select Start to begin the therapy. To deactivate percussion and vibration therapy, select Stop Therapy. Alarms can be activated by selecting the bell symbol to access bed exit and head angle alarms. 3 bed exit modes can be set based on patient needs. 1. Position is the most sensitive setting, detecting if the patient moves away from the head section or toward either side rail. 2. Exiting is the second most sensitive setting, allowing the patient to move within the bed, but will detect if the patient moves away from the center of the bed toward the edge, or begins to put a leg outside the bed. 3. Out of bed allows the patient to get out of bed, but will alarm to notify you that they are no longer in the bed. To set a bed exit alarm, select the mode you want to activate. The bed exit alarm is armed with an audible single tone, and the screen outlined in green stating the bed exit mode armed. A patient must be in the bed with a minimum weight of 70 pounds or 31.8 kilograms for the bed exit feature to be enabled. Out of bed mode is the only mode available during rotation, percussion and vibration, and optorest. If exiting or position modes are active when one of these is started, bed exit will change to out of bed mode. A pop-up will be on the GCI. When the bed exit system is activated and it detects an alarm condition, an alarm will sound and a message will show on the GCI. Press silence and the screen will show 3 alarm options: resume, suspend, or alarm off. Resume immediately will turn the alarm back on. Suspend turns the alarm off for 10 minutes. At the end of the 10-minute period, if the patient is not in the bed, the alarm will sound continuously. Alarm off turns the bed exit alarm off. Head angle alarm assists in maintaining head elevation at greater than 30 or 45 degrees. To activate, raise the head of bed above the desired angle greater than 30 or 45 degrees. Press the head angle alarm control on the GCI to turn it on. The alarm will sound if the head of bed goes below the alarm setting. To respond to head angle alarm, raise the head of bed back above set angle and press alarm off. The scale is activated by selecting the scale symbol on the far right. Under 0, there are 2 options. Both options will tell you the date the scale was last zeroed. Option 1. 0 will only zero the scale. 0 will not erase patient history or settings. Follow instructions on GCI screen. Option 2. New patient will zero the scale, erase patient history, return the surface to normal mode, and turn off all Remind Me reminders. Remember to zero the bed with your nurse's unit's standard linens or items on the bed. Put linen list on footboard for training, testing. A screen on the GCI will pop up with the required bed position for zeroing. If any are not in the required position, it will be highlighted in yellow. Simply use the bed function control until it turns green, indicating it has been corrected. The position is 1. Head of bed lower than 45 degrees. 2. Legs are no lower than 30 degrees in downward position. 3. Bed level is no trend, reverse trend. Select Continue and select Yes or No to the question, do you want to zero? Follow instructions on GCI screen. The bed will beep when zero process is complete with a message indicating the bed has been zeroed. Select OK and proceed to patient placement. Scale allows you to weigh the patient. This page provides a history if the patient has been weighed, including last weight, previous weight, initial weight, height, BMI, and a graphical trend of weights. To weigh the patient, select the green Save Weight. This will show reminders such as remove excess articles. Put drainage bags and pumps on the green hooks, or these items will be weighed with the patient. And place the bed in the recommended position for weighing. If necessary, a patient's weight can be taken out of position. However, it may impact repeatability of weights over time. It will be marked on the history screen that it was not in the recommended position. Press Continue again and Let Go will pop up on the GCI. There will be an audible beep and pop up when the new patient weight has been complete. You will then be able to accept, reweigh, or cancel. Pressing on the BMI symbol allows you to enter patient height, and the BMI will automatically calculate once the patient weight is accepted. If CLRT, P&V, or optorest is active, you will get a pop-up instructing you to put the surface into normal mode. The BMI will automatically be calculated once the weight has been accepted. If you forgot to enter the height before weighing the patient, use the backward arrow to go to the scale menu. Select Adjust and enter correct patient height. To adjust weight or add and remove items, select Options. Adjust weight if you cannot remove the patient for a full re-zeroing of the scale. This will allow you to follow a weight trend from a new starting point. The Add or Remove Items action allows you to add and remove items such as a cast, traction, or other large piece of equipment that should or should not be included in the patient weight, or when the bed was zeroed. This represents your normal pressure redistribution mode. Max Inflate hyperinflates the surface for procedures or repositioning for 30 minutes. At 28 minutes, a warning will show in the GCI. If the mode is not reselected, the surface will automatically return to normal mode. Select the Surface tab from the home screen, then Max Inflate. To deactivate Max Inflate, press the Normal Mode tab. You can also use the Max Inflate button on the side rail to activate and deactivate this feature. Seat deflate can be manually initiated for procedures such as bedpan placement and dressing changes. This will last for 30 minutes. At 28 minutes, a warning will show in the GCI. If the mode is not reselected, the surface will automatically return to normal mode. Select Surface from the home screen, then Seat Deflate. To deactivate, press the Normal Surface tab. Right and left turn assist will turn the patient to the designated side to help with turning patients for procedures and repositioning. This will last for 30 minutes. At 28 minutes, a warning will show in the GCI. If the mode is not reselected, the surface will automatically return to normal mode. This is not to be confused with the continuous lateral rotation therapy that is used for pulmonary therapy. This is for intermittent lateral repositioning. Select the Surface tab from the home screen followed by the left or right turn assist button. The side rails towards the turn must be raised or the bed will sound a triple beep and a pop-up will remind you that the turn will not begin until the rails are upright for patient safety. Raise side rails and select Turn Assist again. Before activating Turn Assist, patients should be positioned appropriately. Larger patients should be centered, while smaller patients pulled slightly away from the side you are turning. If possible, bend the patient's knee and slightly turn the leg toward the side you are turning toward. As the Turn Assist feature starts to turn the patient, hold the patient's bent knee and shoulder to support and guide them into the turn. You can stop the turn at any point with either Max Inflate or the Hold control. For Sleep Mode, select the Surface tab from the home screen, then Sleep Mode. Sleep Mode allows you to turn off the automatic surface pressure readjustment cycling for 8 hours to allow for a rest period while maintaining pressure redistribution. After 8 hours, Normal Mode is automatically activated. To manually deactivate, press the Normal tab in the Surface menu. OptiRest provides a wave-like motion, continuously readjusting cushion pressures while maintaining pressure redistribution. Select Surface from the home screen, then OptiRest. To deactivate, press the Normal Surface tab. Patient Comfort allows cushions to be made softer or firmer based on patient request while maintaining pressure redistribution. Select Surface from the home screen, then Patient Comfort. Use the up-down arrows to make changes. The Reminder tab allows the caregiver to set reminder alarms for 3 different bed features: rotation, percussions and vibration, and turning the patient. The caregiver has the ability to set a countdown clock that will activate an alarm when it is time to use these functions. The Preference tab allows the caregiver to set a variety of different options on the bed, including New Patient to clear the bed's current settings to allow for a new patient, History, language, and to set date and time preferences. Click on the Preference tab, then select from the menu on the screen to adjust any category. The Help button on the home screen is a virtual user manual built into the bed. This will guide a caregiver step by step through any function of the bed. The color display is designed to alleviate any questions by putting the instructions at your fingertips.